Welcome back to the Dentist News Network. I'm Tasia Custodi. I'm joined once again by Dr. Dale Miles, an oral maxillofacial radiologist. Earlier, we spoke with Dr. Miles about the Image Gently campaign. And Dr. Miles, I'd like to chat more in depth about some of the tips you had for dental professionals when it comes to reducing radiation exposure during x-rays. Now, you mentioned that dentists should use the fastest image receptors possible. What did you mean by that?
Well, in North America, the adoption of digital receptors, solid state detectors, not phosphor plates or film, has been quite slow actually. The receptors of the digital flavor were introduced in 1988 and started being sold in 1989 in the US and Canada. Only about 55% of dentists have adopted digital X-ray receptors, and the exposure times are so short that the actual dose to the patient is dramatically reduced by using the fastest receptor. So solid state wired detectors are probably the best way to actually reduce dose to a child, followed by phosphor plates. And of course there are some scenarios where something with a wire isn't appropriate to use on a child, especially a young child, because they won't tolerate it in their mouth. So there's actually new devices out there. Are panoramic machines that allow you to take what we call extraoral bite wings, or the type of cavity detection x-rays that we normally take on children, but externally, using a type of panoramic machine and just collimating to the size of that area. And those actually reduce the child's dose as well, and nothing goes in the mouth.
So could you show us a collimate beam and how it works?
Sure, no problem. I brought one with me. We have a device called the TrueImage, which is a device that fits on any existing dental X-ray tube head. And when you tell us or order it, you basically will get the device with instructions inside. And the type of X-ray machine is important for us to know, because we actually have rubber rings that will fit any size tube head. So I brought a pretty typical one. This is one from the Planmeca company called the ProImage. And basically this grommet or ring will fit on the device first. And then what we have is we have a sort of round device that goes over top of that as well. Once that's in place, you have a typical ring structure that has a rectangular collimation within it. And this device will actually limit the beam size to the size of the intraoral image receptor. By using instruments, positioning instruments like those from Rin or Flow, you put these together, put this in the patient's mouth, and then bring the actual collimator device up to the patient, and LED lights come on that say that it is engaged. So with all of this in place, you can actually take x-rays and not miss, so you reduce a tremendous number of retakes, and you can take, you'll reduce the actual surface exposure to the patient by about 60% just by using the rectangular collimation. So it's quite an interesting device. There are several others out there, but they do not magnetically lock together so that there's a risk of angulation errors. This is actually probably one of the better ones on the market.
What is a thyroid collar and why is it so important?
Thyroid collars have been around again forever. They are used to protect the radiation-sensitive thyroid in a child. The adult thyroid tissue is quite stable and doesn't need that protection. In fact, in the newest guidelines, if you use the fast receptors we talked about earlier, the solid state detectors, the thyroid collar isn't actually necessary, nor a leaded apron for an adult. For the child, however, it is going to be mandatory. Thyroid collar has to be used for all intraoral procedures. And the guideline, I believe, states that it should be used for all X-ray procedures except where it interferes with the examination. That would be the panoramic type examination or the cone beam type examination, where that collar would give us some scatter artifact in the image, which would interfere with interpretation.
Dr. Miles, thank you so much for your time today.
You're welcome.
My guest today has been Dr. Dale Miles, and you've been watching the Dentist News Network.